LGBT-related situations and scenarios. So LGBT health, falls, seizures, head injuries, skin lesions and rashes. You should know how to take your history well. Your ophthalmology needs to be good as well. And know that ophthalmology and all of these, they come under combined stations mostly. And so you can get up to 2 combined stations. That is a history with examination. Confusion with or without electrolyte imbalances, suspected cancers, and your knowledge of the suspected cancer referral pathways, pediatrics as well, and some extra areas that can pop up every now and then. Learning disability stations, patients refusing treatment or admission, pre-op or post-op assessments, needle stick injury. All of these are very high yield. And so if you cover those and you're really good at them, you just keep moving forward. So if you've got any questions for me so far, I'm ready to hear them. I'm absolutely ready to hear. I hope you're all doing well. Thank you for joining. What do we avoid? Generally, we don't leave it until the end. If you don't take this exam seriously, you will hopefully never suffer, but you know what I'm trying to say. You should prepare months in advance. Now, yes, sometimes we're busy. What's the solution for being busy? It's to make a couple of hours a day to doing a scenario so that when you are finally in your final month of preparation or 1.5 months, you have already made sure that your brain can already see some of the difficulties that you personally find with Plab 2. Everyone's Plab 2 issue is different. You need to recognize your weak points because that's what you need to prepare for. With the right guidance from proper tutors, you will then be able to do so as well. But even if you wanted to do things independently yourself, the resources are all out there. Everything you need is out there. Okay. So let's start a station. The way you start your station can depend on the scenario outside. So I'm talking about GRIPS 1. What does GRIPS 1 mean? Well, GRIPS stands for greeting, hello. Wait for the response, hello. When you are saying hello, you're smiling. This is rapport. You then need to introduce yourself and confirm identity. My name is Dr. Radwan Ali. I'm one of the doctors here in the GP surgery. Can I just confirm, are you Samantha Brown? Yes, that's right. Okay, can I confirm your age, please? I'm 30 years old. What would you like me to call you today? You could call me Samantha. Nice to meet you, Samantha. I understand that you made an appointment, or I understand that you had some chest pain. If the scenario tells you why the person presented, you need to paraphrase the scenario. So this is why it's important to pay attention outside what they tell you. They could say FY2 in the GP, Samantha Brown is a 30-year-old lady who presented with headaches. Talk to the patient, address her concerns. Hello, Samantha. No. Hello. Hello. My name is Dr. Radwan Ali. I'm one of the doctors here in the GP surgery. Can I just confirm, are you Samantha Brown? Yes, that's right. Can you confirm your age for me, please? Yes, I am 30 years old. What would you like me to call you today? You can call me Samantha. Very nice to meet you, Samantha. I understand that you made an appointment and that you had a bit of a headache. Is that right? Yes, that's right. Okay. Can you tell me more about your headache? I'm here to talk to you and help you. Can you tell me more about this headache? If the scenario just tells you a 30-year-old lady made an appointment to see you, I understand that you made an appointment. Yeah, I'm here to help. How can I help? And then they will tell you, and you need to listen and act accordingly. So I hope that that's clear for your GRIPS first time seeing a patient. Now let's talk about telephone. When it comes to telephone, things change a little bit. You say hello, they say hello. You then confirm who you're speaking to. Is this Samantha Perkins? Yes, that's me. And then you say, my name is Dr. Gavin Brady, and I'm calling from the GP, or I'm calling from the emergency department. Pay attention. It could be an appointment. Sometimes it could be having to break bad news over the phone. Anyway, can I just confirm a few details, please? I told you guys already, the details that you need to confirm will be inside the room and will be there: the name of the patient, full name, the date of birth, the first line of the address. All of that is there ready for you. So what you need to do is confirm those details. It doesn't require memorization. Can I just confirm a few details? Can you confirm your date of birth? Can you confirm the first line of your address? Sometimes, if you're speaking to a relative, they will even tell you on the piece of paper the details of the father as well. Okay, so they'll say father's name, Tom Brady. Patient's name, Cody Brady. Date of birth, first line of address. Whatever is on that paper, that is what you are confirming. Once you've confirmed the information on the paper inside the room to be accurate, you will then move on and ask, is it a good time to talk? Is there any chance you could be driving at the moment? Would you like to move somewhere more private? Once they say, yeah, I'm fine, you can talk, you'll say, the reason I'm calling. Sometimes if you have to tell somebody over the phone about their STI results and you don't check if it's a good time to talk, they'll be like, wait, hold on. My wife is nearby. I need to move. Wait a second. So you need to always ask, is it a good time to talk? You need to ask, is there any chance you could be driving at the moment? And you need to give them and offer them a chance to move somewhere more private. That is the etiquette over the phone. So 2 main areas: confirm details. Three main areas. Don't say, hello, my name is Dr. Radwan Ali, I'm calling from the GP, until you check you're speaking to the right person. Is this the patient or the person? Yes. Now you introduce yourself, and now you confirm all the details on that paper, and then you will make sure it's a good time to talk, and that is your job well done. So things are going to get a little complicated for the second part. For GRIPS type 2, we follow up. It's a follow-up, type of scenario, or somebody who's already been admitted. The point is, it is not the first time that this patient is presenting. That's what I need you to know. Things have happened before. If it's a follow-up, the patient came 2 weeks ago with maybe tiredness, and then they did some blood tests 2 weeks ago, and it showed that they had anemia. So the last week, when the results were explained, they did further blood tests. They checked the iron levels, they checked the B12 levels, and the patient has iron deficiency anemia. So the story begins 2 weeks ago, and you're here today. So you need to confirm everything that's happened before. So let's see how that goes. Hello, hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I just confirm your full name and age, please? Yes, I'm Samantha Brown, and I'm 30 years old. Okay, and what would you like me to call you today? You can call me Samantha. Very nice to meet you, Samantha. I understand that you are here for a follow-up and that you had some blood tests done 2 weeks ago. Is that right? Yes, that's right. Okay, is it okay if you can just tell me what happened from the beginning? What made you have the blood tests done in the first place? Oh yeah, doctor, I was tired, and then they did some blood tests. You need to listen. Yeah, doctor, I was tired. I had some blood tests done, and they found that my blood levels were low. So then, they did another blood test last week, and I'm here for my results. Okay, active listening while they're talking. Right, well, I am here today to speak to you about your blood test results and discuss further management with you. Before that, is it okay if I ask you about your symptoms that you had 2 weeks ago? You mentioned you were tired. How long have you been tired for? This requires some practice, but you need to be organized. Yes, we always want to know about the tiredness. We want to know how long the tiredness was there for. We want to know if it's the first time they felt tiredness like this. We want to know if the tiredness is getting worse. We want to know how the tiredness started. And we want to know if anything makes the tiredness better or tiredness worse. We want to know about symptoms like dizziness, palpitations, feeling faint. We want to know about shortness of breath. We want to know about chest pain. We want to take DDs and red flags. We want to make sure it's not cancer and ask about weight loss, lumps and bumps, any fever or night sweats, any pain in the bones, any increase in thirst or urination. We want to just do as much as we can based on the blood test results. So if these blood tests, for the example I was giving you, is iron deficiency anemia, my main DDs are not going to be diabetes, but my main DDs of tiredness will be celiac disease, maybe cancer as well. I will also look out for diet as well, because sometimes I need to cover these things in B12 deficiency anemias. And so you just need to stay focused. That's why you will always have 8 minutes. The blood tests already suggest a diagnosis. You need to know what the DDs of iron deficiency anemia are, what the DDs of non-iron deficiency microcytic anemia are, like thalassemia, or maybe you need to know what B12 deficiency DDs are. The point is, when you get there in 1 minute outside, you can already tell yourself, I will ask about 1, 2, 3 DDs. I will make sure there's no red flags. And then I'm going to explain the results, and I'm going to suggest an examination or two, obviously, and I will do the management for iron deficiency anemia. If this is a 60-year-old or above patient, I need to do a colonoscopy and an urgent referral 2-week cancer pathway. How do I know this? Because you are required to study the guidelines. But luckily, you're very much going to be in control because the guidelines are very straightforward. Over time, these things make sense themselves. What I need you to practice is how to start very strong. Your Plab 2 scenario is all about how you began and how you set yourself up for success. One last time, one more time. Hello. My name is Dr. Radwan Ali. I'm one of the doctors here in the GP. Can I just confirm your full name and age? Yes, I'm Samantha Brown and I'm 30 years old. Okay, what would you like me to call you today? You can call me Samantha. Very nice to meet you, Samantha. I understand that you had come 2 weeks ago and that you had a series of blood tests done and that you're here for a follow-up. Is that right? Yes, that's right. Is it okay if you can tell me what happened? What made you have the blood tests done in the first place? She'll tell you the story. You actively listen. Right. Yes, thank you very much. I am here today to explain the results of your investigation and discuss management with you. I was just hoping before that I can ask you a bit more about the tiredness that you mentioned. Take history of the tiredness, do the DDs, any complications, examination, explain the results, and then go in and diagnose and manage. So you're going to be fine because you're going to practice. And I told you before, practice makes perfect. There's a third kind of introduction that I need you to know. The third kind of introduction we're talking about are for anxious patients who do not let you introduce themselves. I need you to think for a moment, why would someone be impatient? It could be different reasons. The most common reason is they're worried about their relative. And because we're talking about relatives, I just need to do one more thing to remind you, if there's a relative involved, we confirm the relationship to the relative. May I know your relationship to Miss Elliot Jones? Can you please confirm her age? Now, commonly, in these types of situations, you could be breaking bad news, but sometimes the person has things to do or the person is really anxious about their results themselves, and that's why. Anyway, if somebody, as soon as you enter, you say hello, they say, hi, doctor, yes, can you tell me the results, please? Or, hi, doctor, how's my son doing? How's my son doing? This is what we call an anxious start. They're very anxious about results. They want to hear things early. You need to take control in a polite way. I'm sorry, can I just please check a few details before we talk about your son or before we talk about the investigations? You then need to introduce yourself, but please don't be slow. Quickly introduce yourself. My name is Dr. Radwan Ali, and I'm one of the doctors here. Can I just confirm your full name and age? Thank you very much. Do you mind if we sit down? Because sometimes they're standing up. You invite them to sit down so we can talk. Make sure you acknowledge that emotion. Look, I can see that you're very worried about your results. I'm here today to speak to you about your results. Okay? I'm here to speak to you about your results. Because the person was very anxious to hear about their results, you can now choose to maybe tell them their results. But it could be breaking bad news. So sometimes you have to take some history. Can you tell me what happened? Can you walk me through what made you have the results in the first place? Make sure you take permission. Is it okay if I ask you a few questions about what led up to you taking the results, if you don't mind? Can you just tell me? And they'll tell you. Anyway, we'll do breaking bad news on a separate day when you are already good with history taking when you're already good with standard kinds of stations. How do you do a systemic review? There's two types. Some people like to do the systemic review by doing CNS, CVS, respiratory, musculoskeletal, GIT, urological, etc. And some people, they like to do a head to toe because they can remember everything by just remembering their body. For example, right, Mr. Johnson, I just want to ask a few questions to cover all the bases. Do you have any headaches, any dizziness, any balance issues, any weakness or speech problems in your face, any ear problems, any neck stiffness, any flu-like illness, any sore throat, cough, chest pain, shortness of breath, moving down. So if you can tell, it started from the head, headaches, dizziness, balance issues, weakness, speech, the ears, the neck. You can even add photophobia if you like, but you have to also pick and choose. And so I just want you to know that when you want to do a systemic review, please manage your time well and follow the systems very briefly.